Hello and welcome to the Happy PharmD podcast. I'm your host, Dr. Alex Barker, founder and coach at the Happy PharmD. And today I am joined by Christy Snodgrass. Christy is a nurse, first nurse ever, I think, on the podcast. And she'll be talking about her journey to patient advocacy. In this, you're going to learn some beautiful real life career exploration insights. I think a lot of people don't understand. I've got this degree. What do I do with it? Where could it lead me? And you're going to see wonderful lessons from a real life example of someone who's gone from, I'm sick of this healthcare system, to building her own job, essentially, and making a huge impact by influencing lawmakers, policies, and helping patient advocacy groups. We've already done a previous episode, which we'll put a link somewhere around here, hopefully at this time stamp, of a pharmacist who was working with patients as an advocate. But in this, you're going to get a different angle. You're going to get an angle of learning about big picture thinking with advocacy. It's a wonderful story with great lessons that I'll break down at the end of this podcast. So be sure to stick around to the end where you can take some actionable steps from Christy's journey and apply to your own to discovering what you could do in healthcare to make a difference and create meaningful work. Before I dive into questions and stuff, and it's Christy Snodgrass. But what is that your last name?
Yes, it is. It is. Yes.
Is that a maiden name or married name?
That's my married name. Yes.
You must love him or her.
Yeah.
To, take that name.
Yeah. Yeah. Prior to that, my maiden name was Poses, and when I took so when I took Snodgrass, I was like, that is a 180. So we're gonna embrace it. We're gonna go for it.
Yeah, that's love.
Yeah, that's pure unadulterated love there.
Yeah. I think snod is snodding, is that the slang for like an old slang term for kissing or like mooching on someone?
I have no idea. This last name I've learned since comes from like a plain in Scotland. It's the name of like a plain field sort of thing, and it's called the Snodgrass Plains, and all of my husband's people come from that one plain. So that's where we are.
Do you know does snod mean something?
I have no idea. No.
Because if changing your name in the States is such a pain in the butt. Oh, you were a nurse. So when you got married and you had to get, like, I'm sure it was a pain in the butt.
Yeah. So actually I got married the year before I got my nursing license. So it was already, already changed. It was already done. Yeah.
Oh, that's so sweet. You were college sweethearts.
We are high school sweethearts. So I've been with my husband since I was 15 years old.
So sweet.
First and last boyfriend. Yeah.
You found him early. Way to go.
Yeah. I told my younger sister was back in the dating pool recently, and she was asking me for advice. And I said, listen, I'm either really, really good at dating or really, really bad at dating. So I'm not sure I'm the right one to be giving you advice here. So
that's sweet. Well, you know what else is unique about you is I think not only are you the first ever Scottish representative of the Snodgrass family on our podcast, but you're also, I think, the first nurse. I could be wrong.
Wow, that is an honor. Yeah.
We are the Happy PharmD, so we tend to, talk to pharmacists. But what I know I randomly found you last year, and I thought, oh, what you're doing is super interesting and cool. And not to downplay nurse profession at all, but any healthcare professional could do what you're doing. And I was really inspired by your story, but I think it would be helpful for some context for pharmacists because I think we all have our stereotypical like pharmacist or nurse or doctor, right, in our heads. And I think it's great to break those down to learn like what drew you into nursing, what
Yeah.
what kind of compelled you to choose that as your career path.
Yeah. So I started college wanting to be a psychologist, but my older sister, went before me, and she majored in psychology. And I was like, okay, how long do I have to go to school? And she's like, well, you need at least a master's. And I was like, and then I can, have a good living and make money. And she was like, no, you need to go back and get your PhD, and then you need to do a residency. And I was like, that sounds like a whole lot of school to me. So let me evaluate my options here. So I ended up taking an anatomy and physiology class, and I loved it. Loved the human body, loved how everything worked. And then I wanted to marry that with the very personal, patient's forward side, which would be nursing. So I was like, okay, this is a perfect fit for me. Let me just go ahead and go into nursing. So I started nursing school, started doing my clinical rotations, and I rotated through this hospital that was just state of the art for my area. Had all the newest technology, had all the what I thought were just the coolest nurses. And they were all really young, and I should have saw that as a red flag at that time. But I didn't. I was like, these are like cool young nurses. It's going to be super fun. So I applied to work there, and it was very competitive at the time. So they brought me into several panel interviews. It was terrifying. They did a phone interview, then they got every single manager in the hospital. And mind you, this is a fairly large hospital. They sat them down at a long conference table, sat me at the end, and had them grill me with questions for like an hour. And this is just for an entry-level nursing position like that. That really does not happen anymore, but it was happening at the time because of everybody wanted to work at this hospital. So I managed to pass that round. And then they sent me directly into an ethics interview where they talked to me about, what would I do in this situation? And if this sort of ethical dilemma popped up, what would I do? So that kind of signaled to me like, okay, they really care. They really want to make sure that I'm making the best decision for the patient. So I ended up getting the job, got hired on. Day one, they started me. I was supposed to be working in oncology, and they started me on renal. And I said, I wasn't hired on to renal. What's going on here? And the director that I was working under said, oh, this is our new nurse residency program. All of our nurses are going to train on this one floor, and then they're going to be dispersed to their individual specialties. And of course, I've never worked in healthcare before. So I'm like, okay, I guess this is how you do it. And then I started talking to the nurses on the renal floor, the senior nurses, and they ended up telling me, actually, that's because none of the other floors have nurses experienced enough to be able to train a new nurse. So I was like, oh, and that was my first red flag working there. So I trained in renal. 3 months later, they released me into oncology. Renal and oncology are very, very different fields. Day one, when I'm oncology, one of the doctors grabbed me and he said, let's go do a bone marrow biopsy. And I said, what is a bone marrow biopsy? And I'm sitting there like looking around to these other nurses like, hey, is somebody going to teach me how to do this? And the charge nurse is looking at me like, just go do it. And I'm like, that's not safe. That is not, I don't know what the doctor is expecting me to do during this procedure, but yeah. I go, he talks me through it. He's very kind. But like down the line, 6 months, they're asking me, okay, do you want to be charge nurse now? And I'm like, I quite literally just got off orientation. She's like, my manager's telling me, you're so skilled. Like you're good with time management. You're good with managing your patients and other people and just building me, right? Like telling me that this is this privilege that only I'm getting because I'm so good at my job, right? So I'm like, okay, if this opportunity is right in front of me, I better be taking it. So I became charge nurse. Shortly after that, I started training new nurses. I barely had a year of experience under my belt. And then I'm getting more and more worn out, but that burnout is being celebrated by my superiors. So it's very much a mind game of like, this is what they like. This is what gets me into higher, better positions, even though there was no change in pay. This is what gets me the accolades. So I'm trying my best to go through this, getting burnt out. And then finally, around year 3 or so, I had an experience where I was charge nurse, I was precepting, I was chemotherapy certified at this point. So I was one of the only ones giving chemo to an entire floor of oncology patients. And I had a situation where 2 of my patients stroked at the same time. And I had a completely new team that did not know stroke protocols. So I'm running back and forth to these patients. I'm telling my team, okay, here are the protocols. Here's what you do. Call the doctor, ask for this. And I'm at that point going to put in orders. And I realized that I almost put in orders on the wrong patient. And that was enough to stop me to say, like, I can't do this. Like, I'm extending myself in 20 different directions at all times. I can never give anybody enough of me. I feel like my patients aren't getting what they need, and I'm not doing what I went into nursing to do. So as this is going on, I am working oncology, so I'm seeing my patients go into a lot of debt, just incredible hundreds of thousands of dollars of medical debt. And I'm wondering, like, I can't even get a $1 raise. Where is this hundreds of thousands of dollars going? Because it's not going to me. The doctors are working at the same rates. Our techs are working at the same rates. Where is this money going? One of the situations that pushed me over the edge was I had a oncology patient who was neutropenic, who was in the hospital for 2+ weeks, recovering from a number of different things. There was one day that she begged her oncologist to discharge her because she needed to go make chicken for a barbecue raffle so that she could pay her medical bills. So she got discharged from the hospital per her request. I go to meet her at this, barbecue plate raffle that she's doing. And she's walking up. She's got a mask. She's still neutropenic. And I'm like, are you kidding me? Like, she left the hospital acutely ill to come make chicken legs to hand out to people to sell and raffle off some stuff that she bought at Walmart to hopefully maybe get somewhere close to paying her chemo bills. So at this point, I'm just like, I need to figure out why this is happening. So I decided to take a job still in the hospital with case management to learn about the reimbursement systems of the hospital. When I signed up for it, the admin played up the role as I was going to be following the patient throughout the care continuum. I was going to be able to get the patient what they needed, and it was my job to make sure that the patient got the appropriate care from admit to discharge. What it really was me making sure that the patient didn't consume too much care in the hospital as to hurt the hospital's bottom line. So I spent the majority of my time questioning doctors' orders because somebody is questioning me saying, why can't this patient discharge? Why did you order this test? This test is not necessary. Whether or not, the doctor thought it was necessary or not, I was made to go question them at every step and make sure that they were doing not what was safest for the patient, but what was most cost effective to the hospital.
When you went to see that patient, was that like the triggering event for you to like figure out what's actually going on here?
That was one of them. Another big event that happened was I had a patient that was newly retired. Like he had retired in the past 2 weeks, came into the hospital, got diagnosed with cancer, started racking up huge medical bills. And I was in his room with him one day and we were just sitting there talking. And he said, you know what, Christy, if I would have known that one hospital visit would have completely ruined everything that I had built, everything that I had saved for my entire life, I would have stayed home and died. And I said, I get that. Like I get it. I get where he's coming from and it's so sad. And I need to figure out why this is happening because we as clinicians, the ones that are, the ones that are giving the care, the ones that are ordering the care, the ones that are supposed to be delivering the care, don't really get a say in how that care is delivered, and we are not included in the loop as to how that care is reimbursed, where this money is going, where these prices are coming from. So that was the aha moment where I decided, okay, I'm going to move into case management. I'm going to look at these reimbursement systems. And then once I found out what was going on and how these things were working, I was perplexed as to like, why did I not learn this in nursing school? Why does the doctors that I work with, why don't they learn this in more detail? And I kind of thought like, okay, well, if we don't know, we need to know, and patients need to know as well. So that's when I started my social media account. And at first I was very hesitant to say anything publicly, right? Because I'm still working for the hospital.
Yeah. And you were a case manager at the time?
And I was a case manager in the hospital at the time.
Yeah, you kind of signed your resignation letter there.
Exactly. So at first, I'm just making like relatable nursing videos, connecting with the nursing community. It wasn't that deep. But then I started somehow like gaining a following. And as I'm watching the numbers increase, I'm like, I have an opportunity here. Like I could do this at a big scale and I may or may not be successful, but I right now have an audience. What am I going to do with this opportunity? So I came home one day, just completely exhausted, and I'm sitting there at my kitchen table with my husband, and I am just like bawling. I'm like, I can't live in this moral injury. But I know that if I start speaking about this publicly, I'm going to be blacklisted. I may be ruining my career, the career that I knew, for the rest of my life if I decide to do this.
And when was that, like timeline wise, like a couple years ago?
That was it was right in the midst of COVID. So the burnout was real. So I think it was 2021, the beginning of 2021. So I told him like, I can't do this anymore. And he was like, well, quit. I was like, okay. Like, it's not that simple, but okay.
What's your husband's background? Like, what does he do?
My husband's in marketing. So, so he was like, well, quit, do what you want to do. And I'm like, oh, okay, but I might be, signing my career death certificate here. And he's like, well, it's burning you out. You need to figure out whether, you really want to do this and you really want to start advocating for nurses and for patients and making this information public, or you want to keep working and doing what you have been doing. And I'm like, well, I absolutely cannot. I just physically cannot keep doing what I have been doing. So I'm going to try this advocacy thing, and then I'm probably going to fail, and I'll go find something that's outside of healthcare, right? I'll become a realtor or something, right? I just like could not do healthcare anymore. So I quit. I started talking publicly on social media. The social media just took off. I was able to go ahead.
Well, I was going to ask, so you practiced for how many years?
Before I quit, I was about 8 years in.
Okay. Yeah, that's actually pretty normal. That's about the time when people say I've had enough. And you start seeing like people leave in droves to other non-clinical jobs. So you quit in 2021, like, didn't, And this advocacy thing, right? This following that you had, it wasn't making you any money, I assume.
Nope. Not at the not at the
Oh,
time.
Chris, I'm already your biggest fan. Like, way to go. Hell yeah. Burn the chips. You're
I was
wow.
all in. And, we got to acknowledge that there's some privilege there. I had savings, I had my husband's income, and
Sure.
I
Yeah.
had potentially a way of making money. I did think it through somewhat before I uh, gave that resignation letter. But it
Yeah.
was very much a leap of faith where I didn't know if it was going to pan out. In fact, I had many conversations with my husband saying, like, a nurse is not going to survive in this space. I'm not going to be able to do this, but I'm going to try. I'm going to give it my all, and then I'm going to go do something else. So I tried, I gave it my all, and I have not yet done something else. So I guess it's still working.
Congratulations. It's a big deal.
Yeah. Yeah. Um, yeah, I mean, it's been successful. So I left the hospital, and one of the first things that I started to do was reach out to every advocacy organization, everybody who was even remotely in the space that I wanted to be in. I just started sending them emails, getting on their websites, filling out contact forms. I got on LinkedIn and started messaging people. And just being like, hey, I don't want anything from you. I don't want a job. I want to know how I can help you and learn about what you do. And that was that was an easier ask for people, because I wasn't like, oh, here's my thing, help me do my
Yeah.
thing. We get sales messages on LinkedIn all
Yep.
day long. They're going to go by the wayside. I said, hey, I didn't take it that way. I said, hey, let me give you some free labor. Here's my skill set. How can I help your organization? I really believe in what you do. And by the way, if I'm helping your organization, can you teach me? I just want to learn more about this sector. So organizations started pulling me in. At first, I was doing a lot of volunteer work. And then from there, it was like I was able to prove my skill set, right? Like I had certain skills that, only a nurse would have, or, somebody who has a social media and has a little bit of media background would be able to provide these organizations who mostly have been operating in the background. And then from there, it was just like people wanted to hire me. And I had this job that I essentially made up. And now people come to me and they're like, oh my gosh, I love what you're doing. How did you get your job? And I was like, I made it up. It's literally a made up job, and I love it, and it's going well.
What was that learning period like for you? How long was it? Obviously, you were very vulnerable in sharing, and thank you that, like, this is crazy. What I'm doing is crazy and it's probably going to fail. And yet you still did it anyways. And so you're interacting with these companies. You don't fully understand the industry yet. So you've really done a good job at positioning yourself in the place of learning. But what was it like? What's some of the weird things that you were doing as you were learning?
So, one of the things that hit me like a ton of bricks right off the bat is the clinical world is so different than the business world. Being a clinician does not necessarily prepare you from being in a corporate setting.
Sure.
So when I'm having these meetings and talking to these people, I literally have a Google tab open, Googling words. I'm like, what is a discovery meeting? What is that, like, what are they even saying? So I'm like
Yeah.
Googling words. And of course, when I'm meeting with organizations, they're talking about things that I've never heard before. And of course, I'm asking to learn, right? Like I want to know what you're doing. But some people don't understand how clinicians aren't keen to these things that are going on behind closed doors. We're not really keen to reimbursement systems. So while people are sitting there saying, okay, well, the FTC is evaluating this thing and we're looking into private equity and blah, blah, blah. I'm like sitting here like, what is all these things? And I'm writing down words. And then after my meetings, I would go back and I would just educate myself. I would go on YouTube. What is this thing? What is this thing? Like, how can I learn more? And that's when I kind of just started building on that education. But throughout that process, it was major imposter syndrome, right? I'm like, how did I even get, like, I am just a nurse here. How did I get into rooms with these people? Why do they want my input? And having to like go through that mentally and feel like I was in rooms where I didn't belong. It took me a while to adjust to that. But I kept getting invited back, right? And that's what I kept telling myself is like, if you weren't valuable here, they wouldn't keep inviting you back to this table. So the fact that they do see value in you. So you need to keep at least showing up. And that was the most important part is like, okay, I'm not perfect at this. I don't know all this lingo. I'm not cut from the same cloth as a lot of these people are, but I'm going to continue showing up and putting in my 2 cents because this is an area where healthcare workers are underrepresented. And I want to make sure that if I have an opportunity to represent us, I'm going to do that.
Beautiful. It's so good to hear you say this stuff. Because I hear people saying all the time in our community, I'm just a retail pharmacist, hospital pharmacist. I've only done a 1-year residency. I only have done this for my career. You did, like, I have to commend you. You did an amazing job at putting aside what I think probably is like a nurse mentality of like, I have to do a really good job. Like, I can't mess this up. People's lives are at stake. And you're able to put that, what I would say is taught for pretty much anyone in healthcare, right? People's lives are on the line. You can't make a mistake. And you, I don't know how you did it exactly, but you put it aside and you just said, I'm a beginner, just help me learn.
Yeah.
I wonder if your first job played a role in that because you were forced to learn things that you were not prepared for. Right. Like that was not the greatest experience, but like it prepared you for this maybe beautifully. I don't know.
You know what? In a lot of ways, nursing very much did prepare me for jumping into a new venture that I had no experience in. Nurses, clinicians in general, thrive in the sink and swim world because that's all we know. All we know is sink or swim, because that's much of us work in those types of environments anyway. So I'm very much like a do and learn along the way type of girl. So it did. I was like, listen, if I can learn how to keep somebody alive on the fly, like if I can learn those things without being like explicitly taught, then I can go about this business meeting, that I can put in my 2 cents in this, hearing or whatever I was a part of. It was scary, but when I thought about it in the context of like, okay, nobody's gonna die. Like those were the stakes I was working up against before, and I survived. So I can do this because, it's important work, but it's not directly tied to a human being right here and right now. So I can figure this out and I can learn and I can make mistakes. And making mistakes was vital to becoming successful at this.
So what was like the first gig like the first time that you got paid? What did it feel like? What was the job like? What were you going through in that time?
Yeah. So the first like long-term contract that I had that wasn't just like a one-off little thing, look over this or whatever, felt like I had made it. And that, right?
Yeah.
Like I have some recurring income and I know this income is going to be here for at least, 6+ months. So it was like that release, like that breath of fresh air where I could be like, okay, I got something, I can relax now. And it was for advocacy works. I was I was extremely picky with who I was going to work with and how I was going to work with them. So being that I had all this bad experience, working for people who said that they were going to do good and then ended up being the complete opposite, I wanted to make sure that I didn't immediately attach myself to anybody. And in doing so, I made sure that I was a contractor in most of my beginning relationships, and I still operate that way. There have been things that I've built, telehealth sites or whatever, that I've had a huge part in, and I've been offered equity in the company, and people will think this is controversial, but I said no. Like, I don't want to be attached to any one thing because of my personal visions and goals, and because I want to maintain the highest standard of ethics, right? And now I'm not saying that anybody who has equity in company is not doing that, but in the beginning, at least for me, I wanted to stay as detached from these companies, and I wanted to make it as easy for me to move to a new company as humanly possible. And that was completely doable. Like, I was able to structure all my contracts in a way to where I could move, I could have an out. I was never going to be exclusive with one person, and I made that explicit in all my contracts. I can talk if you do something, crappy, I'm going to tell the world about it. So don't do anything crappy. So I only worked with organizations who allowed that, and the type of organizations who allowed that were usually the ones who had really high ethical standards. So it was an easy transition from there.
I think some of this will sound abstract to a lot of listeners because we're aware of advocacy groups, right? But like, what do they do? What and why would they contract you? So without sharing, anything NDA related, anything specific, what are some of the things that you're helping people with?
Yeah. So people started to approach me because right off the bat, I realized that advocacy groups were an advocacy group can literally be for anything. There was nurse advocacy groups who, organized marches on Capitol Hill and did education events for nurses. That's an advocacy group. I also work closely with another advocacy group that helps hospitals enforce 501(r) federal charity care regulations. That's all they do, is they just help patients apply for charity care and help enforce those laws. There were government agencies that were approaching me and saying like, hey, we need a nurse's perspective. We saw you online. You seem to know something about this industry. So like, come help us with this project. So when people use the term advocacy, you're thinking, like a direct patient service, like a patient advocate, and you're walking them through the process. And that's one route. And I did that as well. But advocacy is literally anything to help further the betterment of the healthcare system.
Are these typically like nonprofits that you're working with, like associations, or are they government bodies or something else?
Some are. So there's a lot of nonprofits in this space, but there's a lot of for-profits that offer services. There are, there are some telehealth companies and or like patient-facing services that are trying to bring services to under-access areas, and they need somebody with the experience who is a clinician and also, knows patient advocacy and knows the patient and knows, what they are and aren't going to do. There are law firms, that want somebody who's experienced with, how does a nurse case manager work? What's your typical, workload look like? What are you doing for the patient? What does the inside of a hospital look like as it's running? So law firms have asked me to give input there, kind of as a legal nurse consultant. And there's just like, there's endless amounts of opportunity, which is why I don't have an elevator pitch, right? People come to me and they're like, Christy, what do you do? And I'm
We
like,
do everything.
I do whatever is in front of me. So it's funny because a lot of times when I'm talking to other clinicians who want to move into advocacy, they want to be extremely, laser focused. Like, okay, I am a cardiac nurse. What can I do in the cardiac field to do advocacy? And I'm like, there's plenty of things that you can do in that field if that's what you want, but you also have inherent skills and knowledge as a nurse, as a clinician, that other people want. So you just need to go fishing to, whatever area you're interested in, say like, hey, how can my specific skill set help you? Because you don't have to specialize if you don't want to.
Mm. I think it's an interesting approach, and I can understand why so many clinicians would find that nerve-wracking, because we like specifics.
Oh yeah. Oh yeah.
We want step-by-step instructions, and we want to be accurate and correct and do all the right things.
Right.
So for you, how many more years before you testify in front of Congress?
Not many. I was on Capitol Hill last year talking to a bunch of senators about some bills for workplace safety for healthcare workers. Yeah, it's coming. I mean, I'm already working closely with government agencies, trying to do more advocacy work. And again, the first time I've met with the FTC before about some projects that I've been on. And the first time that I was, in front of the Federal Trade Commission talking to them about, certain issues, I was like, I should get somebody smarter to be in this room, because it's not going to be me, right? But it was like the most relaxed environment, and they were like engaging with me because they didn't know what nurses were experiencing. They barely, because of the reasons that I was scared, they barely get approached by clinicians to talk about issues. The same thing, I went with an organization called Impact in Healthcare, and we managed to get a meeting in the White House with the assistant to the president for public health. We were sitting there in the White House talking to these people, and we're telling them healthcare issues, we're telling them nursing specific issues. And one of the things that one of the members commented on was like, you know what, we don't really hear from ground level healthcare workers that often. Like, this is new information, and it's old information for us, right? We're talking about staffing, we're talking about, safety at work. This is way old, but our firsthand accounts of this stuff is not getting to them in a way that's effective. They're hearing it on the news, of course, there's articles, whatever, but they're not having healthcare workers coming to them saying, I need to talk about this. Can we please sit down and have a conversation about what this looks like firsthand as we are experiencing it? So it's just like, I need clinicians, I need pharmacists, nurses, doctors to get into those rooms, because we're holding ourselves back, because we're so scared to be in those rooms, to try something new, to enter into this more businessy, political, corporate world, whatever it is, where we're not bringing a unified voice. We're allowing the media and whoever is controlling the media at that moment to be the voice for us, to tell the public what is wrong and what is right with healthcare. But we're not getting to be that voice ourselves. So one of the biggest issues I've experienced over the past few years as I've been doing this is I've been trying to pull clinicians with me, like, please, I need your voice. Because if I get in front of somebody who is telling me that what I'm saying is not true, they're going to point to me and say, you are a one-off. That situation doesn't happen that often. But if I have a whole group of healthcare workers who are using their voices too, then it's no longer, they can't deny it anymore. It can't be a one-off anymore if we're all saying it, but we are so scared to speak up, and partly because there's a lot of retaliation in our field as well. So I'm really like, I need those healthcare workers who do have the privilege of speaking up to speak up.
If someone did want to speak up and maybe help you in what you're doing, how could they do that?
There's a number of different organizations. If we want to talk about like grass tops, there's a number of different organizations that they could join for doctors, pharmacists, clinicians in general. There's an organization called Take Medicine Back that is a coalition against the corporate practice of medicine. They do a ton of political work, a ton of groundwork. There's also a more nursing focused group that I just mentioned called Impact in Healthcare. There's lots of different organizations that are doing like actionable things that you can get involved in. But I think probably one of the most important things that clinicians can do right here is, if they have the privilege, knowing that they potentially could be retaliated against, it's a thing. But if they have the privilege of saying, no, I'm not going to do that. No, I'm not going to take that assignment. Hey, this patient needs this thing. This is not right. They need to speak up. I have found that clinicians, my demographic of people, are just so extremely scared to speak up, to move. Even let's not even talk about speak up. To move. If you are in a terrible job that you hate, leave them. You need to let that employer know this is unacceptable. We as healthcare workers are not going to work in these conditions. I'm going to go find a better job. But so many clinicians are, we're trained to be martyrs. We're trained and programmed to say, I can't leave. The patients need me. Because these are all true things, but this is the things that, the top has been telling us in order to keep us in positions where we can be exploited, right?
Yeah, I just spoke with a pharmacist client last week, and she said her biggest hurdle right now to even applying for something else is feeling guilty about what her boss is going to say when she quits.
Yeah. Yeah. It's a huge deal. Leaving oncology, I felt the exact same when I left. The hospital that I was in bragged about their oncology department because they were one of the only hospitals in my area that could do chemotherapy inpatient. So they literally had billboards that was like state of the art, we're the only oncology, whatever. I and two other nurses were the only nurses in that entire hospital who were certified to give chemotherapy. And whenever you give chemo at that time, you needed 2 certified nurses on shift. So being that there was only 3 of us and there's 7 days a week, if I left, we wouldn't be able to give chemo anymore. Nurses only work 3 days a week, or supposed to. So I knew that if I were to leave, that A, chemo would stop, or B, the hospital would certify a nurse who wasn't ready to be certified. They would try to get a new nurse in there real quick to be certified, and it might not be the safest option for the patient. So the amount of guilt I felt leaving the floor, knowing that was the case, was enormous. But I couldn't work in that environment, and the hospital needed to know that.
It sounds like you got in touch with your values and priorities to make that decision, because
yeah,
I don't think anyone wants to feel guilty or shame, right?
Yeah.
But they often let it influence their behavior.
Yeah, and I think the hard truth that we as clinicians need to admit to ourselves is what we allow is what will perpetuate, right? So when we allow our employers to treat us certain ways, when we are forced to work in certain conditions, we're propping up that system. We're allowing those conditions to perpetuate because they know we're not going to say no. So if enough of us were saying no, they would be forced to change. This is why, hot topic. This is why unions have been wildly popping up all over the nation especially since COVID. Because when collectively as a group you come together and you say, this is unacceptable, here are our terms, either negotiate or we're out, they have to do it. But it can't just be one person speaking up. It's got to be a unified voice.
Yeah. I'm reminded of this video clip that I just saw a couple weeks ago of, I believe it was Google or Amazon, one of the big, tech companies. And it was a government hearing about them speaking up and how they're getting started. I believe it was Google. And as the guy begins speaking, he gets someone immediately comes up and starts speaking to him and said, "Oh, I've just been notified that I've been let go."
Yeah. Yeah.
It is a risk.
It's a risk.
Something that you may find encouraging about our profession is that things have gotten so difficult in the retail setting from a work environment perspective that the new media narrative right now that's being propagated is that there is a shortage of pharmacists because they can't get pharmacists in these stores. But the truth is that pharmacists are unwilling to take those jobs. There's plenty of graduates right now. There are more than what we need, in fact. But people don't want to work in those settings, even when they're offering $70,000 and $100,000 sign-on bonuses and relocation stuff.
Yeah.
It's cool to see, but to your point, media drives attention and the narrative, and media can control even policy, right, and regulation when things go bad, particularly in healthcare, like what just happened with United Health Group and the giant cyber attack. I'm not sure if if you heard of that recently,
Yes.
but
Mm-hmm.
yeah, and how now the government's getting involved and saying that they need to mandate some sort of security involved. It's a mess. It's a mess.
Yeah.
And so I agree with you. The future is murky, but I think that we are, especially this next generation that's coming up, I think is poised very much to drive change, and it may be ugly how things change, but the current model is unsustainable.
Yeah, it definitely. And they created the same narrative about nurses post COVID, right?
Oh, really?
Nurses were leaving in droves. Like I think the number was like 500,000 nurses were leaving bedside at that point.
Whoa. Aren't there only like there's 3 million doctors, right? Or 3 million nurses?
I'm not.
1 million doctors and 3 million nurses.
Yeah. Yeah, no, I don't know what the exact numbers are, but they were anticipating that it was huge. So, it was this narrative that hospitals started that, COVID was just really hard on us all, and nurses had to take that voice back. And I saw my colleagues just like collectively say, COVID did not make us leave nursing. COVID was the final straw that made us leave nursing. But what you have done, these situations you have put us in prior to COVID for years and years and years, is why we are leaving. We are no longer able to work bedside. So I remember distinctly that so many articles came out where nurses were actually speaking up about this because of the original news releases that nobody wants to work bedside. Nurses are leaving because of COVID. And so many nurses came back and said, it's not COVID. COVID was the final straw, yes, but COVID is not what changed our perception on nursing. Nursing has been this way for a long time. And something needs to change. Nurses are not willing to work in those conditions anymore. And we see the new, Gen Z nurses coming up, right? And they excite me so much because they just will not take it. I have seen so many Gen Z nurses just walk onto shift. They try to hand over a bad assignment. I'm out, and I'm going to be looking for a new job too. So the newest generation of clinicians have heard and paid attention to our generation, because I think our generation is the first to really be speaking up about it, especially publicly. So we're like, yeah. So we're saying, like, you know what, this is not okay anymore, and maybe only a few of us are speaking because a lot of us are afraid for our jobs or whatever. But the nurses coming into the profession are already aware, whereas us, we still went in with some blinders on, right? We still went in with this altruistic martyr mentality of, this is a calling and I'm going to do it no matter what, and I'll kill myself for this job. And so that's not what the newest generation of clinicians are doing. They're coming in with eyes wide open for the very first time ever, and I think it's going to make a positive impact eventually on our system, but it's going to cause a lot of tension in our system in the meantime, as we're seeing right now.
Well, Christy, you've been super generous with your time with me. If your mission was to make me a fan, I'm on board. I'll help out with whatever you have going on next.
Awesome.
If other pharmacists listening to this want to learn more about you and the work that you're doing and supporting you any way that they can, where can they go to do that?
My website is healthcarereformed.org. That website hosts a number of resources for patients and clinicians, advocacy resources. And then I am on social media. It is Christy PRN on Instagram and TikTok.
You told me the link earlier, and now I finally get it.
Yes. As needed. Yes. And then, of course, I am on LinkedIn as well, if anybody wants to reach out.
Sorry, this is meant to be like a pitch for you, like, please go follow her. But like, I don't know why, but that was like a dad joke that really got me. Are you a mother?
I am, yes.
Yeah. Okay.
Yeah.
So you're okay with dad jokes like
that? I love it. I love it.
Oh my gosh. I don't know why. That really tickled my funny bone. Oh, that's clever. Okay. Christy, thank you so much for being on the podcast and sharing your story. It's very brave of you, and I want to commend you. It's hard what you chose to do, and you deserve all of the success that's coming your way.
Thank you. I appreciate it, Alex.
Oh, what a great podcast interview. I'd love to break down some of the things that Christy shared in this. There's a couple of ideas here that I want you to walk away from. If you're thinking about what is next for you in your career, I think it's a great point of view to find a problem that you care about and you want to solve for others. You'll notice that Christy was driven by helping people. She told some incredible stories about patients who really influenced her and what she was doing and her desire to learn more. Why is it that healthcare costs so much? What is it about this? And so it drove her to learn about case management. You have tons of problems in your life, and pharmacy is maybe one of those problems, and you see it on a day-to-day basis. What are the problems that you are curious to learn more about? Maybe it is. Maybe it's about patient advocacy, or maybe it's about the cost of drugs. Maybe it would drive you to actually go into managed care, PBMs, pharmaceutical companies, and learn more about that. Why is it that we have the system that we have? And that could lead you potentially to start your own thing Hopefully it's not like Christie's journey, because she was driven to a point where she just had enough. She had learned the system, wasn't happy with it, and wanted to change it. But I think that's a beautiful thing, to learn about the problem. And the next thing I'd like to really hone in on is her learning time. I think so many pharmacists feel stuck in their career journey and really wonder, like, well, like, I can't get experience doing the thing that I'm interested in. So no one's going to give me a job. No one's going to help me. No one's going to learn or let me learn. But Christy had a wonderful privileged opportunity to stop her job and just learn. If you are considering, let's say that you're thinking about joining case management. You're thinking about joining PBMs, specialty. You're thinking about doing clinical work. Well, what if you reached out to people in that space? You reached out to software tech companies that provide services. You reached out to insurance people in that space that provide that service. You reached out to associations, of course, that are in that space, or maybe even advocacy groups for whatever aspect. You reach out to them and you just ask them, what can I do? How can I help? I'm great at this. Is there something that I could do or volunteer or help you with? And by learning that, by getting behind the scenes and helping and doing, you gain the experience you need to find a solution for problems. That's all career development is. That's all a happy career really is. It's picking and choosing the problems that you want to solve for other people. And I think it was so beautifully demonstrated here in Christie's story. I don't know if she knew that I was going to break down her career at the end, but there's wonderful, rich lessons here. Everyone has problems in this world. And that's all business and jobs are. It's solving problems for other people. I think that if you just spend some time thinking about the problems that you enjoy solving for others, what businesses are out there doing that, and how could you help them? What could you learn to them? What could you volunteer? What could you bring value to? That is a powerful thing that anyone can do right now. Heck, it's how I got to where I am. Back in 2012, I coached people for free. I joined a forum full of people that were doing career exploration, and because that's what I was doing. And we were all experimenting and trying different things. It was called the 48 Days Community. It was run by Dan Miller, who sadly passed away just a few months ago. And it was full of just inspirational people who were like sick of the 9 to 5, sick of trying to go through the grind. And I remember joining that community and finding out, what are your problems and how can I help? And so I began to coach people for free. And I don't know, I did that for like, 4, 6 months, something like that. And I remember the moment when I got paid my first ever $47 a month to help this guy with what he was working on. And that was such a rich, it was like, oh, all this is worth it. $47. And it's led me to where I am now. And I love what I do. Every moment is filled with joy and true creativity and inspiration. And I wouldn't give any of it up. It's my encouragement that you take an action today. Take one problem, solve it for someone else. And I can guarantee you that other people will have that problem as well. I would be honored to be a part of your journey and help you out in that direction. So we would love to talk to you. Our career advisors are poised and ready to help pharmacists take steps in that direction to get clarity about what problems they could go solve and help create some action steps towards that. If you're interested in working with a coach to help speed that process along, make it that much clearer, whether you're wanting to start a business on the side, whether you wanted to get into a completely new career path, or you don't even know what career paths to do, our team is on standby, ready to talk with you, just like talking with a community pharmacist about a health problem. We're here and ready to help you get clear about the next steps of your career and the work that you would find fulfilling. Thanks for watching this episode of the Happy PharmD podcast or listening to it wherever you are. Let me know if you liked this episode. Please comment, share, and even share like a key takeaway that you've got from this podcast. I would really appreciate it. And if we missed something, if we should have asked for something, I'd love to hear that too. I'm always trying to improve my ability as a podcast host, and I would appreciate that. Thank you for listening and watching. Until I see you in the next one, take care.